Traditional health insurance controls healthcare through bureaucracy, endless paperwork, and corporate interference. This system has promised security, while quietly delivering frustration, delays, and declining care. For decades, it has positioned itself as the only gateway to quality healthcare. Yet behind the pre-authorizations, denials, coding requirements, and shrinking visit times, both doctors and patients are asking the same difficult question. Is health insurance improving care or interfering with it? This town hall exposes the prison of health insurance. 3 courageous physicians who have pushed back against the system now step forward to reveal the truth. Dr. Elisabeth Potter, board-certified plastic surgeon specializing in breast reconstruction, shares the realities she faces inside the traditional insurance system and the pushback she gets every day while caring for her patients. Dr. Scott Barbour, board-certified orthopedic surgeon and founder of Barbour Orthopedics and Spine, reveals how leaving insurance transformed his patient-centered care. Dr. Simone Gold, physician, attorney, and founder of Gold Care, moderates a clear-eyed discussion reclaiming autonomy, trust, and dignity in the doctor-patient relationship. Together, they explore how the insurance model shapes decisions, outcomes, and lives, and what becomes possible when doctors and patients finally break free. What follows revisits long-held assumptions about covered care and shows what often improves when control and complexity are removed. Gold Care, built for you, powered by freedom, trusted by thousands.
Welcome to Gold Care Medical Town Hall. Thank you so much for being here tonight. Okay, so we're going to do this a little bit differently. Unfortunately, we've had some of our guests have had conflicting schedules that they weren't able to make, so we are going to switch things up a little bit here. I've got Dr. Gold with us tonight. I've got Dr. Richard Ammerling, who is the academic director at Gold Care Health and Wellness, and myself, Drew Kachurik. I am the vice president of business development here at Gold Care Health and Wellness as well. I want to let you know a few things about tonight's conversation. If you're like me, I know you felt trapped inside the healthcare system. It feels completely out of your control. I've definitely been there. Long wait times, denials, rushed appointments, decisions filtered through layers of bureaucracy. These are not isolated incidents. They are the predictable result of a system structured around third-party payers instead of patient-centered care. Tonight, we will examine one of the most complex aspects of healthcare, and that's insurance. We'll expose how the current model reshapes medical decision-making, limits physician autonomy, and distances patients from the care they actually deserve. We'll explore how financial incentives often conflict with clinical judgment and what becomes possible when doctors are free to prioritize people over paperwork. This conversation is part 1 of a 2-part series where we'll continue the deep dive on insurance and teach you about the realities of what you're really paying for. You'll learn specifically what we're doing to help our members take full control of their health, from routine care to layers of security to protect you and your loved ones in the event something serious happens. We have a lot of exciting updates happening at Gold Care, but I don't want to spoil anything for you just yet. Let's get to the conversation. Dr. Ammerling, let's go.
Well, hello, everybody. Thank you all for tuning in. We're going to be talking about medical insurance and third-party payment. Third-party payment has been very destructive of the patient-physician relationship and of medicine in general. Why is that? Well, because someone else paying for your care puts a third party between you and the physician. That's not good. The relationship must be between the patient and the physician. Third-party payment directly counteracts that. And it also imposes lots of burdens, ultimately. If there is an insurer who is dealing with the patient, that is one thing. But if the insurer is paying the physician directly, that changes the game in a way that creates, I think, an unethical playing field where the doctor cannot truly represent the best interests of their patient because someone else is paying them.
Right. So first of all, I just want to thank you so much, Dr. Ammerling, for being here. Dr. Ammerling is a former professor of medicine and has a wealth of experience as a physician. And I think most of you know me, and I want to thank you for being patient with us while we got a little bit of technical delays. And I'm so sorry that our other guests also couldn't join us tonight. There were all kinds of technical difficulties tonight, plus surgeons, sometimes their call schedule runs late. But this is a subject that Dr. Ammerling and I are both very, very passionate about, and we both have a lot of experience with. So it's just as well, right, Richard, that like you and I will be the ones talking about health insurance. So I will say that, people came to know me because of the COVID years. The reason I got activated, though, was really the summer of 2008. And as you remember, back then, Obama was running, and he was running on Obamacare. That was a big part of his platform, also known as the ACA, the Affordable Care Act, but everyone really just kind of colloquially calls it Obamacare. And those of you who can remember, he said, nothing in this act will change your ability to keep your doctor. You can keep your doctor. I'll never forget that because it was so specific and it was so explicit. You'll be able to keep your doctor. So that's the starting point, is that the way he sold it to American politicians and the American public was a bald-faced lie. You, of course, cannot keep your doctor, and everything else they said about this program has really been mostly false. And even in the areas where it was true, it's been incredibly detrimental to patients and to physicians and the industry as a whole. So Dr. Ammerling is really familiar with this, and I'm really familiar with this. And that's what we're going to explore tonight. And I'm so glad that you're here also tonight, Dr. Ammerling. I think we should talk about what is just maybe where insurance started from, how health insurance used to be, and as opposed to where it is today. Like, what are your, you've been a doctor longer than me, and so you remember how insurance, it didn't used to be quite as evil as it is now.
That's true. In fact, it used to be direct payment from the patient to the physician at the time of service. And then the patient would bill their insurance company. And the doctor might provide a slip saying that they saw them, they did this and that procedure, and charged X amount of dollars. And the insurance company, depending on the contract they had with the patient, would reimburse either the totality of it or part of it. And that was a reasonable system, right? It didn't impose any undue burdens on the physicians. The physicians were totally free to practice the way they saw fit. And in fact, the early days of Medicare in '65, it was set up that way as well. The patients paid their physician. The physician charged what they called their usual, customary, reasonable charge, and Medicare reimbursed it. Very simple.
I forgot about that, Dr. Ammerling. The UCR, the usual
UCR.
Great, that's right.
And in fact, there is a line in the Medicare entitlement law that prohibits the government through HHS, the Health and Human Services, from interfering with medical practice in any way. So with that setup, most physicians opted in. So it was a very popular program among physicians. And why wouldn't it be? It was, they're getting their fees kind of guaranteed by Medicare. And a large number of patients, Medicare was initially just for the elderly over 65, later somewhat expanded to certain diseases such as end-stage kidney disease. I knew a lot about Medicare back in those days. But the scope of it was broad to begin with. And of course, costs expanded, which was predictable. But of course, they were caught unawares. The costs went up by a factor of 10 higher than they thought they would. So they started to clamp down and impose all sorts of controls.
So insurance, back when health insurance really started gaining traction, it was treated like other insurance. It was treated like car insurance. It was treated like kind of a catastrophic financial risk pooling. So you would throw money into the pot, your neighbors would throw money into the pot, your friends would throw money into the pot, and then rarely something really expensive would happen. And then, the pot would be there to cover that expensive situation. And we all are completely familiar with that. That's how insurance works. Most of us or all of us have car insurance. Many of us have home insurance. That's how it works, is you put it in. And the whole mechanism of insurance, paying for expensive, rare events, is a very different financial model than paying out of pocket for ordinary consumer purchases. We don't have to go into all the math of why, but here's one reason why paying for a rare, pooling your expenses, pooling your money to pay for a rare event is so different than a regular purchase, think about what has to be ready in case of a rare event. I'm an emergency doctor. To be ready for a rare event is very, very expensive. The ER has to be staffed and stocked and equipment, and people have to be ready to go. That's kind of a crude analogy, but what I'm trying to convey is that ordinary purchases are not well paid through an insurance process. So many things went wrong. A lot of it started with Medicare, as Dr. Ameling is mentioning, but we kind of shifted from using insurance as it's supposed to be used into using it just for ordinary consumer purchases. And when I say ordinary consumer purchases, I mean your doctor visit, that's an ordinary purchase. The prescription for your chronic medication, that's an ordinary purchase, right? If you want to get a colonoscopy, that's an ordinary purchase. None of this was supposed to be covered by like a risk and insurance model. And, you've been practicing a long time, Dr. Ameling. I mean, I even at my age, I noticed the shift when insurance changed from more of that financial risk to ordinary purchases. It really changed the flavor of medicine.
Yeah, completely. It went from an insurance system to simply being prepaid care. And
Yes.
you would launder your premium money through this third party, i.e. an insurance company, who then would pay for your care. Well, wouldn't it be cheaper if you just paid for the care directly instead of triggering the whole insurance process with all the attendant paperwork, multiple statements, explanation of benefits, the EOB? Just pay directly for the care and you eliminate all of that. Plus, you eliminate a huge administrative cost. And the administrative costs of medical care are enormous. They have grown like crazy, along with the number of actual administrators in medicine.
Right.
The growth of administrators in medicine has far outstripped the growth of physicians and other providers.
Right. So providing care through an insurance company, when that care is essentially just prepaying routine expenses, a very expensive way of paying for the care. Instead of paying your doctor $100 or $200, it's pretty much double. And I'm not joking. And it's because there are third-party administrators. There's the insurance company that has to manage all of that. As Dr. Ameling mentioned, the administrative burden on getting this all set up and then paid out grew exponentially. And therefore, the insurance companies then put brakes on the system. They then started saying, hey, maybe we don't want to pay for that. Maybe that's too expensive. And then they started putting in layers of bureaucrats to approve or disapprove. That's called prior authorization. None of that existed prior to a few decades ago. I'm just letting people know if you were born, if you're in your 30s, you don't even know that was never how it was. This concept of going to essentially an insurance company to be authorized or approved, and then they tell you where to go and who to go and how much they'll pay and what they'll do and when they'll do it. That is all new over the last few decades. But the biggest fundamental problem is that we're essentially prepaying. It was perfect that you said that, Dr. Ameling. We're prepaying for ordinary care. It's no longer just for expensive, risky situations, and it's very expensive to deliver care that way. Very expensive.
Yeah, and in fact, the insurance model was actually turned upside down. So instead of paying for the rare catastrophic event, such as major surgery or a bypass, a car accident, they pay for the routine care. And by the way, with greater cost, obviously, in the system, and it's extremely expensive the way they do it. But then if it comes to a large expense, say you do need an operation, they'll try to get out of paying. So instead of actually covering you for the catastrophic event, they're trying to dodge that. They pay for the small stuff, but if there's a big event, a big expense, they deny. And you may have to go back to them several times to get a prior approval to have the procedure done.
So first of all, that is shocking, like what you just said, Dr. Ameling. I'm not sure if viewers are aware of that. You're writing the check every month, or your employer's writing the check every month. These are large amounts of money. If your employer's doing it, you don't even understand how much it is. But for the average family of four, this is about $2,400 a month. So between your reduced wages, money that would have been in your pocket, but for the employer buying this policy for you, or if you're a small business owner, or if you're self-employed, you know what the cost really is. Those costs, the insurance company pretty much is like, okay, we'll cover your colonoscopy, we'll cover mammogram. We have a lot to say about those things anyway at Gold Care, but we'll cover those things. But then they really nickel and dime you on the really expensive items like big trauma. Most people, rational people, would want the exact opposite. They'll say, hey, I'd rather just pay for the smaller stuff myself as long as I know that the big thing, if it's coming, is covered. And that is something that I turned to really around the time Obamacare was coming. I said, I've got to get out. I've got to get out of this. Many of you heard me say I've been out of the insurance model really since probably 2010. I washed my hands of it. It's a deficient system. So before we get into that, I want to turn it back to Drew for a moment, and then we'll keep going.
Thanks, Dr. Gold. Yes, so a lot of great conversations here. Dr. Amerling, you're absolutely right. The prepayment for care is definitely happening, but that care is so inflated, that routine care, it's outrageous anymore. We do have a lot of great questions coming in on the chat. I just wanted to position one of them because you briefly touched on Medicare, Dr. Amerling. How does insurance work, and or Dr. Gold, for Medicare who are paying out of pocket for alternative treatments? Is there an option, or is there anything that can be done to help with that sort of thing at the Medicare age or Medicare level?
There is an option. Yeah, private contracting with opted out physicians is legal, and it is done all the time. An opted out physician has to inform the patient that they are opted out and they cannot bill Medicare for the services. But it is certainly legal and it's done all the time.
I think I appreciate that question because I sympathize with, most Americans have paid into Medicare all their life, and then they reach 65 and they have this Medicare coverage, and then they find out a lot of things that they might be interested in are not covered, et cetera. And what I can tell you is you have to separate in your mind the expense from your health. If you need something from a health perspective, you have to figure out how to enable that. That means you need smart doctors who can give you unbiased advice. And then you have to check if it's covered. If you're over 65, it's Medicare. I would urge people who are not Medicare age to be done with the insurance model because it's not giving you freedom and it's not giving you choice. But once you're Medicare age, what I urge people is to keep their Medicare essentially for the really expensive things. But if there's something they need, you shouldn't say to yourself, no, I'm not going to do that because it's not covered by Medicare. You should decide, is that something that makes sense for my health? These are different decisions, your health versus your finances. And just because the government has set it up a certain way doesn't mean you should let your health suffer. Switching to the younger age group, but leapfrogging off that question, is Medicare, you've paid into it, so you should avail yourself of it when it does what you need. But when you're younger and you have the choice not to be on a particular program, you should be going for maximum flexibility. That's why I really appreciate that question. Why should you lock yourself into what the insurance company says? Medicare is an insurance company, happens to be the government insurance, but it's an insurance company and it tells doctors what to do. And then from there, Blue Cross, Aetna, Kaiser, United Health Group, they all kind of follow what Medicare says and does. Like they're the big elephant in the room, Medicare. So the other companies follow. And then the doctor has to follow that. There's one point I want to get across is that the doctor-patient relationship in modern times has to now operate within the insurer-employer relationship. The doctor-patient relationship operates within and subordinate below the insurer-employer relationship. When you have a question or a problem and you're talking to your doctor, you think that you're getting straight information from that doctor, and you're unaware that that doctor is already operating within a certain paradigm that he has to comply with how the insurance has set it up. He has to go to the medications that the insurance company has picked. He has to go to the hospital that the insurance company has picked. He often has to go down a procedure list in the order that the insurance company prefers it. He often has to comply with things that your independent doctor may say, I don't even think you should have. For example, if you don't get this shot, or you don't take this medicine, or you don't do that blood test, the doctor doesn't get paid. You as the patient sitting there are not even aware that you're operating in this model. The only way you become aware of that is if you step outside and you pay a doctor directly. That's it. That's what Dr. Ameling was alluding to. Is this thing covered by Medicare and what to do? Correct me if I'm wrong, Dr. Ameling. What are your thoughts on this?
No, you're absolutely right. And Medicare, as I said, started out as this very open-ended, generous program. But as the costs went up, they tried to clamp down progressively, first on doctors' fees. And ultimately, this led to a downward spiral in doctors' payments from Medicare because they tied their payment ratios and their boosters to the overall costs of the system. But whenever you pay doctors less, they see more and more patients to compensate. Their volume of services, in other words, goes up. The time spent with each individual patient must go down. The quality of care must fall off. And the whole system becomes overused. There are more tests ordered, more consultations requested, more hospital use, all this because they simply ratcheted down on the payments to physicians. So the total cost will continue to go up under that model, but that's what they use to base the payments on for the coming year. So you have a downward spiral in the payments to physicians, so that physicians increasingly cannot make a living seeing Medicare patients. They are not getting paid enough to cover their expenses. So you're going to have trouble getting patients to take you if you're a Medicare patient, getting doctors to take you if you're a Medicare patient. The number of doctors who can will shrink. That's the way it is now with Medicaid and has been for a long time. Doctors couldn't afford to take care of Medicaid patients because the reimbursement was so tiny. Well, Medicare is reaching those levels. So you're going to have to go outside of Medicare for care that you need and go to someone who will take money directly, modest fees, right? But who will take care of you and not follow the protocols and guidelines that are imposed by the third parties.
By the way, that's not an exaggeration, everybody. So everyone knows I used to live in California. I was there for more than 20 years. And I would tell you that by the 2000s, early 2000s, you actually could not find a general internist who accepted Medicare like in the affluent areas of Los Angeles. They didn't exist. They didn't take it. So it is coming. That is the way it is. So if I was Medicare age, what I would do is I would pay a doctor for their time, cash, like we do at Gold Care, right? You pay, you get that information, you find out what you need, you get an unbiased, independent assessment. I then would go to the Medicare system and get what I need. That's what I would do. That is the safest way to do that if you're Medicare age. And I urge everyone who's a Gold Care member of Medicare age and everyone who's not a Gold Care member who is Medicare age to use it like that. That is the best way that you can use Medicare, is to get unbiased, accurate information. You are totally unaware of the biases that your doctor has. And you know why? The doctor's unaware of the biases that they have. If they don't comply with all these rules and regimens, they actually don't get paid. So it becomes part of the charting system. Here's another piece of data that patients don't know, and Dr. Ameling knows as well. The charting system, you go in to see the doctor, right? You're sitting there, and then all the doctor's doing is looking up at you every few seconds, but they're clicking. And you're like, why are they clicking so much? One of the reasons they're clicking so much is because the systems are set up as accounting programs. They would like derive from accounting programs to capture every single word and thought that could possibly increase the billing charge to Medicare. The charges, it's unbelievable. That is what the programs are. So when you go to a doctor who takes insurance, again, Medicare is one of them, you have to comply with this kind of charting regimen that doesn't benefit you. If you've ever been involved, for example, as I have been as a doctor and a lawyer in medical malpractice litigation, and you go back and you review a patient's chart, you will find shockingly that the chart is almost, it's like useless, mostly useless, overwhelmingly irrelevant to the patient's condition in both ends. So if you have a minor problem, let's say you go to the urgent care and you have a sprained ankle, and that's it, you know what it is. You didn't need to go to med school. It's a sprained ankle. Maybe you went because you wanted an x-ray just to be sure. You go back and you get that chart, and I'm telling you, odds are it's 9 pages long with a whole bunch of data in there that is totally relevant. No STDs, no med, like all kinds of stuff that doesn't matter. Ever wonder why? It's there to capture certain kind of billing criteria. And the opposite end is true also. If you're very sick and you're in the ICU, they have to document very carefully to get compensated. Well, if you look closely, you'll see that the notes are often copied from day to day to day to day to day, just copied, because everybody knows this is how you play the game. It's an absolute secret within the industry that that's how it is. So at Gold Care, we don't do any of that. We don't make our doctors comply with ridiculous kind of documentation criteria that is geared for billing purposes. All of that is to comply with the insurance companies. That's just one example that you as the patient don't even know that you're being gypped. You're sitting there, you want to talk to the doctor, and instead you're getting click, 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 click. It's not even really, it's not for you, even for your own good. You think maybe they're documenting heavily on, my condition. Yeah, mostly not. What are your thoughts on that? I know that I'm very passionate on the subject.
No, you're absolutely spot on. I remember the days we used to write our notes by hand, with a pen and a paper chart. And you were kind of limited in what you couldn't write all day long. So you had to be brief and concise and use abbreviations and your own kind of shorthand. But you documented stuff so that you could look at the chart and remember what you had done, and that another physician who was going to help you take care of that patient perhaps could also look at your chart or look at your note and see what you had done. And that was really the function of the medical record. It was utilitarian and very sparse and economical. But when Medicare introduced the RBRVS, the Resource-Based Relative Value Scale, which coded how doctors get paid based on the complexity of what they do and the time spent, et cetera, all nonsense, Stalinist nonsense, really, then that created the need to document an elaborate history and physical. And then you would actually, have a printout of that, or that would go into the electronic chart, and that would demonstrate to the billers, to the coders, and then Medicare, if they did an audit of your chart, that you justified billing at a higher rate. And if you didn't do that, they could come back and say, you overbilled, and we're going to collect from you. We're going to audit you and collect based on our findings. And this has been done, called the RAC audits.
Right.
So, so the whole system is what an old colleague of mine called the Potemkin village of medicine. The electronic medical record is designed to make it look like magnificent medicine is being practiced, that an incredible history detailed in every degree has been taken, that a thorough physical exam has been done, and that a thorough differential diagnosis has been gone into, when in fact it's mostly boilerplate, computer-generated nonsense.
Right. And the reason I'm harping on this, everybody, is because you're paying insurance premiums every month. And then when you go in and you see a doctor, in my opinion, you are being stolen from. The cash that you paid out every month, $2,400 a month for family 4, you should be able to get 10 or 15 minutes with the doctor where they're actually looking at you and thinking of you and talking with you and having a conversation with you. And you're actually not getting that. And you're feeling kind of guilty. Oh, the doctor's rushed. The doctor's busy. No, the doctor's become a data entry clerk. The doctor has become a data entry clerk. Click, 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 and just documents. And these programs, these electronic medical record programs that are used all over the nation, all of them originated as accounting programs. They all originated from the accounting departments to capture revenue. So I know as an ER doctor, they would send me back charts and say, Dr. Gold, you didn't check off 6 systems, right? I'd have an ankle sprain, but they're like, I didn't check off the heart, the lungs, because if I checked off the heart and the nose and the lungs and the stomach and the kidney and the eyes, all of that, the hospital got paid more. And I'm like, it's just an ankle sprain. Oh, no, Dr. Gold, if you check that off, we'll get paid more. I'm like, but it's not relevant. It doesn't help, doesn't do anything. That is the open secret from people who are in the business. I'm mentioning this over and over because if you're paying cash out of pocket every month to an insurance company, and in return, you're getting like 1 to 2 minutes or 3 minutes of a doctor's undivided attention, and the rest of the time they're clicking on this, you're getting cheated of your money. This is why I stepped out. I stepped away from the health insurance model long before COVID. I stepped out probably around 2010 or so, because I knew that the insurance industry was not giving me value for my money. And in my case specifically, More than that, I cared about the freedom. I cared that the insurance companies were going to try to tell me which doctor I could see if I needed something. Well, I'm an insider. I'm not listening to any network. I'm not listening to an insurance company tell me who I can see. If I needed something, I was going to get the guy I knew was the best. And for that reason, primarily, I stepped away from the insurance model. And that kind of brought us, many years later to Gold Care, and why we want to bring you something much better, something much more like old-fashioned health insurance. So when we come back, we'll get into that.
Thanks,
Drew?
Dr. Gold. Yeah, so the questions have continued to come in, and they're all really, really good. And a lot of them we've answered just by default. But there's a great question here from Mark talking about how he can not use Medicare and only use Gold Care, or how does he use both? He's concerned with something serious happening, even though he's always paid out of pocket. I will say that the insurance companies and the medical industrial complex are really good at scaring us into thinking we have to carry insurance. But I think this is kind of one of those trust your gut answers, where you need to continue to use Gold Care or something of that nature, pay out of pocket, see who you want to see. And then there are some financial safety nets, Dr. Gold, that we'll talk about for people to use that can make sure that nothing terrible happens and that they're not financially bankrupted because of a health issue.
I have to take that question, Dr. Aaron. I just have to take, first and foremost, separate your health questions and concerns from the payment model. Just separate them. The industry has done a great job in making you think they're the same. You ask somebody about their health, how they're feeling, and they often will get into some story about their health insurance. The two really have nothing to do with each other. You've done the right thing, Mark, in that you've instinctively, or for financial, for whatever reason, you actually have them separated. You're buying what you need and you're wondering about Medicare or insurance. You need what you need. Everyone needs that. That's Gold Care. You also, in my opinion, should have a financial safety net. That is my approach. I'm not saying you have to. I'm saying it's rational to have a financial safety net. That's what I did for myself. When I left the insurance model, I said, I still need a safety net. You can get hit by a car, you can have some terrible diagnosis, and this thing could be $50,000 before you know it. That makes sense. That's what insurance used to be. I used to have what's called catastrophic health insurance. Catastrophic health insurance, sometimes called major medical insurance in the past, would cover you for those big expensive things. Obama did away with them. That is the problem. That's why you're kind of like floundering. So in your mind, separate the two. You need a doctor who tells you good, smart things, unbiased, independent. That's Gold Care. And you need a financial safety net. Until now, I personally have used a health share. That is my financial safety net. And we do offer that at Gold Care. We'll teach you how. However, we are going to come to you with a much better insurance product, Gold Care Insurance. It will come to us starting in April, starting next month, and it will mimic what health insurance used to be, which is to cover for the risky, expensive items. Dr. Armley, wouldn't that be great to have like an old-fashioned kind of health insurance product on the market that you could buy?
Absolutely. You remember during the Obamacare debate, which I was heavily involved with, there was this idea that health care and health insurance were the same thing. Remember that?
Yes.
Right? That if you didn't have health insurance, you didn't have health care. Well, now you have health insurance and you still don't have health care, right? You have this horrible system that is restrictive and it tries to limit what you can spend when you really need it, right? They'll pay for the small stuff, but when you really need it, it's not there for you. So it's a complete scam. Health insurance is not health care. Healthcare is what you get when you pay directly for healthcare, for example, through Gold Care. And that's what we're offering. And of course, there used to be these catastrophic plans, health savings accounts. I mean, everybody would have been fine with a health savings account that they could contribute to and have grow during their younger years and use that to pay for their routine care, and then a catastrophic insurance policy if you get really sick or have an accident. And that has become increasingly difficult to get, and Obamacare made it that much more difficult.
Exactly. So there's a lot of complex layers to this about why catastrophic health insurance plans are mostly not available. They are available. You can purchase them, but they're not something, for example, employers can use. And most insurance policies these days, health insurance policies these days, are sold with employers negotiating the contract with the insurance companies. And essentially, Obama said you can't do catastrophic plans. Literally took away the entire reason to have health insurance. So the Obama plans force the patient to buy coverage for routine things like an annual doctor visit, a preventive wellness check where you can get your vaccines and shots, to get your lipids checked. It forces the person to buy, or the employer to buy, a policy that covers all these routine things. And it should also cover the expensive things, but there's limits. Most people want the opposite. Most people say, hey, you know what? I can manage the small stuff, but give me the cheapest policy you can get that'll give me financial safety. If we ask people on this call, like what they buy for their automobile insurance, I've always taken the highest deductible that the company will allow and the lowest monthly rate. I mean, you don't have an accident every day of the week. You don't even have one every year. You don't even, I haven't had an accident, God, I don't want to say, but like it's been decades, that's what the insurance is for. So Gold Care Insurance is going to once again allow you to have that financial safety net, to make all the decisions yourself, to have the doctor-patient relationship front and center. We didn't even get a chance so much, Dr. Emmerling, to talk about one of the terrible things of health insurance. One huge thing is the financial, that is just taking a lot of money from people, not giving them anything, confusing them as to this being healthcare. But the other, right, is how much it changed medicine and the ethical costs it's done to the patient, to the doctor. It's made the doctor, like I said, like a data entry clerk, not necessarily putting the patient first. You should definitely talk about that, because that ethical loss.
It's not only that, but the quality of the medical care that you're going to get in this third-party mainstream system is just awful. It reminds me of the joke about the two old ladies who were talking about a restaurant that recently opened up, and they said, yeah, the food in this place is so bad. And the other one says, yes, and such small portions too. Yeah. Medical care has become awful. I think you are running a real risk every time you go to a mainstream doctor who's going to spend 5 minutes with you, clicking on their screen, filling in all the little boxes that they're supposed to fill in to get maximum revenue, instead of addressing your problems and helping you to get healthy again. That's right. The last thing on their mind, frankly.
Right, and it's
it has destroyed the patient-physician relationship altogether.
It's much easier and much faster for the doctor to see you for 5 minutes, write your script, send you to a consultant, and be done with you. Like, that's the model now. And so Dr. Emmerling is right. I don't even think it's safe really to go to doctors outside of the Gold Care Network. There are some, I shouldn't say none, but they're hard to find. We found them. So that's how come I know that ours are good, but it's pretty unsafe. As an ER doctor, people in their 40s were already on about 4 meds. People in their 50s were on usually about 5 or 6 meds. They never get off the meds. And then you start running into polypharmacy, where you have dizziness and weakness and all sorts of side effects from the meds. And I agree with you, Dr. Emmerling. I don't think it's so safe to even go to the doctor. If you're going to go to an outside doctor, you should go armed as an intelligent consumer. That is one of the things that Gold Care can do for you. We can give you that independent, unbiased opinion. And then if you want to go to your insurance doctor, you need something, or you want to, whatever reason you might have, you at least go in as an armed, as an intelligently educated, armed consumer, frankly, much like you would do in any other area of your life. It's just that we've kind of left to the insurance gods and the government gods your health decisions, one of all the decisions is like the most important. So I just wanted people to realize the hidden incentives that insurance doctors have. They're from the charting system that they're using, which is steering you in a certain direction, to the fact that the whole compensation model favors really short visits that push you on meds or push you onto procedures or push you onto consultants. These are steering mechanisms that you probably weren't even aware of, to the fact that the whole way the doctor's thinking about the next step for you is under the rubric of the insurance employer model. Listen, I don't want that for myself. I don't want it for you. I just want people to get straight answers and to have a financial safety net. The Gold Care Insurance piece of it is the financial safety net and gives you complete freedom in using it. Drew, you probably, you were very aligned on this. You were wise to the health insurance problem years ago.
Absolutely. And I was very young working at a law firm, and I had health insurance through my job, and it was $90 a month out of my paycheck, which seemed reasonable. It covered me and it wasn't that big of a deal. And then I got married. And when I went to my employer and I said, hey, I need to add my wife to my health insurance, it was $300 a month. And I thought to myself, gosh, I'm just adding my wife and she's my same age. And how do we go from 90 to 300? But, I just sucked it up and did it. And then we decided we were going to start a family. And it was so funny because when I said, okay, now we need maternity coverage because my health insurance didn't have it, it was $1,000 a month. And we couldn't get pregnant for 18 months in order for that maternity insurance to turn on. So in my mind, I'm thinking to myself, I'm paying $1,000 a month for 18 months, and then I can start a family. Who can tell me that I can or can't do that? That's crazy. And so much like you, I started doing some research. We ended up going the cash pay route to have our first baby at the hospital, which was $1,800 cash to deliver a baby at the hospital at the time, which made way more sense. And we had a health share. We joined Liberty Health Share many, many years ago. And ever since then, we've done our second child born on cash pay. We've done the broken arms. We've done the x-rays. We've done the emergency room visits. And it really isn't as scary as it sounds. You just have to know a little bit, and you have to be willing to ask some questions and make it work for you. But it makes way more sense for us to carry a health share at, I think we pay $365 a month for me and my wife and my 2 kids. And then we cash pay everything else. And our health insurance, our healthcare costs are much lower because we're very proactive about it. So it's very possible. I hope that helped answer a few questions we've been getting kind of along those lines too.
Yeah, and Gold Care Insurance will seek to partner with doctors in the community who set cash prices. One of the other dirty little secrets that insiders know is almost everything you buy in medicine is cheaper by cash, and by probably a decimal point. Like, it's probably 10% of the price. It's absolutely shocking. We probably had kids around the same time, Drew. Maybe I was a little bit before you, but I remember my first baby, the charge was $26,000 in the hospital. I mean, it had no basis in reality whatsoever. I was in the hospital for 23 hours. I actually left early. It was a normal delivery. There was no complications, and it was $26,000. This is what happens when third parties are paying for things. There's these prices that have nothing to do with reality. So you deliver for $1,800, probably 5 years earlier than that, I delivered for $26,000. This is what it is when the person isn't pulling the trigger. So we get away from that model. The other advantage that you do, as Drew mentioned, is he got to choose who he wanted to see. That's a big issue. So I don't know, Dr. Amerling, you're probably excited that we're bringing Gold Care Insurance. It's a new offering that we're having.
I think it would be great. Absolutely. I think there's a huge need. People have to get out of this very sick system of third-party payment and be able to have freedom of choice and get doctors who will take care of them instead of work for their paycheck. And most doctors today are employees. I mean, when I trained and was in my first 20 years of practice, most doctors were private practitioners running their own small business. And they had a tremendous interest in satisfying their patients. That's the only way that they survived, was providing excellent care in their office. And that gradually, because of this third-party system that became more and more onerous and expensive to navigate, pushed doctors out of the private system into the hospital system, where they became actual employees, and they're working for the hospital or the payer, which is virtually the same thing at this point, right? They're all merged into this one medical industrial complex. So they no longer have the freedom to treat you the way you ought to be treated, with adequate time and attention, and to take your problems seriously as the individual patient that you are, rather than just clicking boxes and following protocols. And we saw what happened in the hospitals during COVID. Doctors who were working in the hospital had to follow hospital protocols to give patients this horrifically toxic and ineffective drug called remdesivir that they must have known wasn't working and was actually killing patients. But if they stood up and said, no, this is unethical, I'm not going to do this, they're out, they're fired.
Right. That is a great example. I don't want people to forget. So the reason the hospitals had these protocols is it was a Medicare protocol, and all hospitals take Medicare, and Medicare reimbursement really, it went way up if the patient got remdesivir. So it was a terrible drug. It was a lethal drug. It was a drug that wasn't approved to be used for lethal illnesses, but somehow was approved to be used for the, SARS-2, which had a very low mortality rate. Especially, it really had a zero mortality rate unless you had multiple comorbid conditions. So these are decisions that are happening to you and to your loved ones, and you don't even know. You don't even know. Your best shot at not letting the system hurt you is to have an advisor who's unbiased. You can't change the hospital system. You can't change the Medicare doctors, but you can work in those systems if you're intelligent, right? If I ever, God forbid, have to go to a hospital one day, I will have the wherewithal to be sure that I am not mistreated the way I see patients being mistreated all the time. That is the vision behind Gold Care. I invite everybody to join. My heart breaks when I hear the stories of ways that doctors have intentionally or negligently and accidentally misled patients. Not all doctors, they're not necessarily trying to do the wrong thing, but the whole system is not set up to be centered around your best interest. So if there's some take-home messages here, one of them is you need a smart, independent, unbiased advisor. Everyone needs that. 100% of people hearing my voice need that. That's what Gold Care is. You should absolutely join. You should have joined yesterday. You should have joined last week. You should join tonight. You should join immediately, because you need that. You think you'll need it in a year from now or 6 months. No, you really need it immediately. We also try to keep you from even needing the doctor. We do tons and tons of education, things like tonight, to help you avoid ever having to see the doctor, go to the doctor, pay a doctor. That's one thing. Another thing is start thinking about the fact that health care and health insurance are unrelated. They're unrelated. You may choose to have some kind of health insurance product as a financial safety net. You may choose not to, but it has nothing to do with your healthcare decisions. Your healthcare decisions have to be you and an advisor who you trust, who doesn't have other incentives other than your well-being. That's healthcare. And over here is health insurance as a financial safety net for you. Just separate those two in your mind. Gold Care can help you with both. We are so excited to bring you Gold Care Insurance starting next month. Drew, maybe you want to invite people to learn more about that?
Yeah, absolutely. As Dr. Gold's telling you, so Gold Care Insurance is coming to the marketplace. It'll be here in April. You can go to goldcare.com/insurance. We'll tell you a little bit about it. We'll tell you what we're planning on doing. Most importantly, there's an interest form on there that we just ask a few basic questions. We'd love for you to fill it out so that we can keep you in the loop as to when we're ready to launch. But we are getting back to what insurance used to be. This is the financial safety net that is very affordable compared to traditional insurance. And it allows you to still choose and decide the type of healthcare that you receive. This is not locking you into in-network or out-of-network doctors and lists of people to choose from. It is the financial safety net to get you what you need in case something serious happens. And it's all backed and powered by Gold Care, which has the doctors and has the educational information for you to make the best choices possible for you and your family. So it's goldcare.com/insurance. I did drop the link in the chat. Go in there, put your name and email address in there, and we'll keep you in the loop when we're ready to launch in just about a month.
Drew, are there any other kind of broad questions that people had? Otherwise, I'm sure
there's been quite a few questions. A lot of people are concerned with the what ifs, right? And we hear it all the time at Gold Care. What if this happens? What if that happens? How do I navigate cash pay? It seems like it'll be so unbelievably unaffordable. And I think, my quick response to that is that I think if you just ask, you'll be pleasantly surprised about what cash pay healthcare really does cost. It is very reasonable. It is very affordable. We use Gold Care to see our doctors virtually. However, if I need to see someone here in my hometown in Southwest Florida, there's a doctor down the street and it costs $50 to go into her office. Now, I don't pay $2,400 a month in insurance, but if I have to take myself or my daughter or my son there, $50 is very affordable to go in and get really good care. And that's just a cash pay rate. So, and all I had to do was ask. I said, hey, I don't have insurance. Can I pay you cash? She said, yeah.
You know what's really important about that is actually if you have insurance, you're not going to believe this, guys. This is like a secret. If you have insurance, they can't give you the cash rate. It actually violates insurance rules. It's very important that you don't tell them you have insurance. When you go into some place and you say, and they'll say, oh, it's X amount of money, or what's your insurance? Say you don't have insurance. What's your best rate? You will be shocked. You know, our other guest tonight who had to cancel because she was still in surgery, she was operating, Dr. Potter, she got so angry and furious at how badly the insurance system was treating her patients. And she does constructive breast surgery, which is very expensive, right? That's OR time, that's surgical time, that's post-op visits, pre-op visits, you know, it's expensive. She's doing it for a fraction of the cost of the insurance model. I ask you, how is that possible? How can she be doing it for a fraction of the cost? It's because the costs are inflated and really have nothing, the charges have really nothing to do with the actual cost. And if you pay the person directly, you'll get much closer to the actual cost. So I hope you listen to us. We've all had experience with this. And it's scary because you grew up thinking you had to have this thing over here to navigate American life. And it turns out it's not true. You just have to kind of let go of that cord, and you will find on the other side much less expensive and much more freedom.
That's great. That's exactly right. Thank you guys so much for coming. Dr. Amerling, did you have any parting thoughts you'd like to share with everyone?
Yeah, I would like to say to those that have Medicare, for example, or an existing policy that they are happy with, keep it. I mean, don't run away from that. That's good to have, but consider joining Gold Care to help you get good care through that system, because it's very likely you're not getting good care. You're getting overprescribed. You're getting short shrift for your actual problems. And if you want help with those, we can help you and help you work within your system to get the best possible outcome.
Oh my gosh, thank you for saying that. I God forbid anybody would walk away from tonight thinking, you know, you have to do X, you have to do Y. We are nothing but, if not a freedom platform. We are here to give you the best medical advice. Part of that is we know that the insurance model isn't healthy for you. So that's one of the things that we're going to be offering. But foundationally, we really just want to get you good care, good advice. We know you're not getting the straight answers that you need in your doctor's office. Even if you think you are, almost for sure you're not. Please, you know, accept our invitation to come to Gold Care, learn more. If you're interested in insurance, then goldcare.com/insurance. We'll send you more information, but we just have doctors that are interested in helping you.
That's exactly right. And I just want to reiterate, there've been a few questions about canceling insurance, canceling Medicare, not signing up for Medicare. We would never tell you not to do those things. Like that would be irresponsible of us. We're a freedom platform through and through. If you qualify for Medicare, by all means, we just want you to understand the importance of how you access that care and how you use that care. Just because you have it and they tell you have to do X, Y, and Z or get these tests or see the specialist isn't always the accurate information you want. So Gold Care can be that ideal second opinion for you to come in and see our providers and really learn what is necessary so that when you do go use Medicare or you do go use your traditional insurance product, you are very, very well informed on how to have those appropriate conversations with various doctors and various specialists that you go to see. So again, it's goldcare.com/insurance. We'll love to tell you more all about it. You can sign up for Gold Care there as well. This is, I said at the beginning of this call, this is the first part of a two-part series. Our next town hall is April 14th, and we will continue this insurance conversation. We will dig a little deeper. We'll dive a little deeper to share more information with you about what we're doing with Gold Care Insurance and how we can best help you. Thank you so much for coming tonight. We really appreciate all of you guys, and we will see you in April. Thank you. Good night.
Good night.
Do you feel like the healthcare system is failing you? That's because it is, working exactly as intended to prioritize profits, bureaucracy, and big pharma, while leaving you and your family vulnerable when you need care the most. We understand your frustration. You've been asked to trust a system that feels rushed, impersonal, and biased. You deserve better. That's why we created Gold Care. Here, your values matter, your choices matter, and most importantly, you matter. Gold Care is more than a solution. It's a revolution. Trusted by over 10,000 members nationwide, we've built a system that puts your wellness first. With ethical, independent doctors who work for you, not the system, you'll have access to care that's transparent, trustworthy, and aligned with your values. We understand that stepping away from the familiar can feel daunting, But staying in a system that doesn't truly serve you is even harder. That's why GoldCare offers a healthcare alternative designed to work for you. Whether you're ready to step away from the system entirely or prefer to keep your insurance while seeking the transparent care, ethical doctors, and education you deserve, it's time to stop trusting a system that's failed you. Take control of your health with GoldCare. Join today for $17 a month and become part of a healthcare revolution. GoldCare, built for you, powered by freedom, trusted by thousands.